Hello and welcome to another episode of A Slice of Health, the Candid Health Chat podcast, where we slice away health truth from health fiction. Join me and my friends as we challenge common health myths via chit chat, powered by several cups of coffee. Don't forget to subscribe and follow us on social media, and do visit us at asliceofhealth.club. Let's get to today's episode. Welcome back to The Slice of Health, where health comes alive, with stories that heal and knowledge that empowers. Before we jump into our topic for today, I want to tell you a story. Carol is a woman in her 40s who, although she hasn't gone through the menopause, feels she is starting to become perimenopausal. She has been experiencing increasing tiredness, muscle aches and pains, and sometimes feels like sleep is just not adequate. Carol has a normal BMI, at least what is considered normal. She eats lots of salads, lots of fruits and vegetables, and drinks minimal alcohol, although she hardly ever turns down a Merlot. A few weeks ago, her mother, who is in her early 70s, had a fall and fractured her hip. The doctor told Carol that her mother has something called osteoporosis, and that has made her bones more fragile and susceptible to fracture. The doctor explained that this is something that can sometimes happen in women after the menopause because of the lack of the estrogen hormone and how that affects the bones. Carol is worried. She wants to know what she can do to prevent herself from having a similar fracture. And although her mother is on the mend and getting better every day following surgery and with the help of physiotherapy, Carol doesn't ever want to need to have surgery because she's broken a hip after a gentle fall. So Carol is asking, what should she do, and what does osteoporosis mean for women and for women after menopause? Healthy bones are generally in a cycle of what we call building and rebuilding. Healthy bones are strong and they're able to carry our body weight. Now, bone mass peaks around the age of 30, and after that, the density and the strength of the bone starts to reduce. This is part of normal aging. Osteoporosis, as Carol's mother had, is a condition where the bones start to become weaker and they become more likely to fracture. Women are more likely to develop osteoporosis than men, especially after the menopause, because of the loss of estrogen and these hormonal changes that happen during the menopause. Other things that can sometimes increase the risk of menopause includes having a family history of menopause, or also previously having what we call fragile bones. Also, having a fracture previously can also increase your risk of having osteoporosis. Now, some of these things are risk factors that we cannot change, but there are factors that we can change. Things like avoiding use of tobacco, avoiding excessive drinking of alcohol, avoiding having a lifestyle where you don't move much, but then also intake of calcium and vitamin D is actually really beneficial. So today, I want us to talk about vitamin D and physical activity that helps our bones for the long term. We can normally get vitamin D through the sun, but if you live in a climate where there isn't much sunshine, then you're gonna need to help yourself a little bit. Sources of calcium come from dairy products like milk and yogurt, but you can also get them from leafy green vegetables like kale and bok choy. Things like sardines are really strong in calcium. Fortified foods can also have calcium, things like cereals, but do be careful about added sugar. Also, almonds are really rich in calcium as well. Now, vitamin D, in addition to sunshine, can also be gotten from egg yolks, fatty fish like salmon, mackerel, and tuna. So, what do we know about vitamin D and calcium? They're both necessary to help maintain bone strength, which is why we normally recommend adequate intake of both of these on a daily basis, especially the vitamin D. Where the calcium is concerned, it's actually easier to get that through your diet, and most people do not actually need to have a supplement of calcium. And in some situations, it can cause more harm than good. But vitamin D has been shown to improve our bone health, but is also implicated in the well being of our body and also preventing other kinds of health conditions. Other things that can also help our bone health are weight bearing exercises and resistance training. So, weight bearing exercises includes things like lifting weights, dancing, climbing stairs, while resistance training is weightlifting, using resistance bands. Things like push ups and squats as well are really good. Other activities that do help with bone health and can actually prevent falls include things like yoga and Tai Chi. So, we're back again with the benefits of ancient medicine. So, what do we recommend? Incorporating resistance training 2 to 3 times a week, making sure that you're doing weight bearing exercises during the week as well, and other lifestyle modifications that we would normally talk about, such as quitting smoking, limiting alcohol, and maintaining a healthy weight, is really important. If you have an elderly relative where you're worried about them having a fall, have a conversation with them. Make sure that there's adequate lighting in the home. Make sure they're wearing good footwear with support. Make sure they're getting their eyes checked regularly. Keep an eye on their blood pressure, especially if they're taking medication that can sometimes drop their blood pressure. And think about hazards in the home, especially loose carpets and rugs that can easily slip. As we know, our health can sometimes decline as we get older, but there's lots of things that we can do to try to strengthen ourselves and improve outcomes as we move forward. So, what should Carol do? In Carol's situation, we would recommend that she starts to incorporate resistance training, weightlifting, and some good, steady yoga or Tai Chi into her daily activities. But also, we would recommend that she starts taking some vitamin D as well. And that is something her mother can also do after she has ongoing osteoporosis care. So that's it from me. Today, we're talking about bones. Make sure you're getting your vitamin D, regular exercise, and making sure that in your exercise, there's resistance training, weight training, and thinking about how you can support your bones. It's best when it's started early. Until I come to you again with stories that heal and knowledge that empowers. Bye for now.
Thank you for joining us on today's episode. Remember that this podcast in no way replaces the advice you receive from your own doctor or physician. Don't forget to subscribe and follow us on social media. Leave us a review on iTunes so that others can access the amazing content. And don't forget to be a health champion wherever you are by separating health fact from health fiction.